The chance that you will get measles in a room with somebody who has measles is somewhere like 90%.
Hundreds of measles cases scattering the globe.
It's really kind of jarring when you hear about it happening kind of in your own backyard.
Cases on 2 campuses in Southern California.
A single case of measles in infant under 1 year of age.
Sick infants before they even had a chance to be vaccinated.
Confirmed case of measles on board a cruise ship.
Vacationers quarantined.
You do not have the right to endanger your children or worse, other people's children.
And now states, including Utah, fighting back. Thanks for staying with us for this special report. Tonight, a deadly disease from the past re-emerging in 2019.
It's the health scare spreading quickly across the world. We want to arm you with information you need to protect your family from the measles. Mike?
All right, so the number of highly contagious measles cases nationwide is the highest it's been in 25 years, with 704 cases reported in 2019 alone. That's according to the CDC. Doctors are urging vaccination, saying without the measles, mumps, rubella vaccine, many of us got in the middle school, well, the outbreaks would be much, much worse.
The reason there's only 700 cases as opposed to 70,000 or 700,000 cases is because of the vaccines that we have.
The latest scare in New Jersey, where a passenger may have exposed others at the Newark airport last month. A cruise ship heading to its home port now after being docked and quarantined in St. Lucia after a crew member tested positive for the disease. And measles now in every country in Europe, 29 dead, with the highest number of cases in Italy, France, and Greece. This mom in England going viral after posting photos of her daughter who has been hospitalized with measles. She's too young to get the vaccine herself. Deanie.
Utah is 680 miles from the ongoing measles outbreak in Southern California. But Nevada, Arizona, Colorado all have reported measles cases. And the state's latest vaccine data shows school kids are at risk, especially in certain districts. KSL investigative reporter Mark Stevens breaks down the numbers.
The state health department tracks vaccination rates at schools every year. The 2018 report shows 5.3% of Utah's kindergartners had an exemption from the state's vaccine requirements. That's very worrying for public health professionals because the National Institutes of Health says 96% of a population needs to be immune from measles for herd immunity to work. That's where so many people are protected from the disease that it can't spread from person to person successfully. 2 of the 3 largest school districts in the state don't meet that herd immunity goal of 96%. The Alpine and Davis school districts are close, but both are under 96%. The Granite School District does have 97.4% of its kindergarten class meeting vaccination requirements. The school districts at highest risk are Paiute, Kane, and North Sanpete, all with exemption rates in the double digits. That pushes the students' herd immunity well below the 96% threshold public health officials want to see for measles. State law allows parents to exempt their kids for medical, religious, or personal reasons. Nearly all the exemptions were given for personal reasons in the latest survey.
Mark, thank you. Well, measles hasn't made the trip to Utah yet. We know it's just a plane ride away. It's another disease that has a major concern for schools here in Utah. Dave?
Well, we learned this week even more cases of the mumps have been confirmed down in Sanpete County. There were just 2.5 weeks ago. Now the district confirms 6 with 5 more suspected. As news specialist Sam Penrod reports, that outbreak's keeping unvaccinated kids home.
We understand that there was 1 more confirmed case in our district.
Superintendent Sam Ray with the North Sanpete School District says that since the mumps outbreak was first reported on April 10th, the district has followed the health department's recommendation to keep all unvaccinated students or those without records of their immunizations out of school. That was initially 10% of students in the district. However, many of the exempt students are now back in class.
We actually had quite a few kids who had been immunized, but their parents didn't have the records when they registered them, so they just marked exempt. And those parents just simply brought in the records. And then we've had several, quite a few who have actually gone and got immunized. So we've cut that roughly in half.
For those students who have not been able to attend school, particularly those in 7th through 12th grades, they are using their school-issued iPads to do their classroom work through the district's online system.
The technology really helps to kids to try to stay current in their classes and try to not get behind when they can't be there. So we try to leverage that technology as well as work with parents and students to try to get them caught up and to help them stay caught up. We're trying to do what we can. We know it's not perfect, It's not the same as being there, but we're doing what we can to try to help these families.
With the 26-day exposure period for this outbreak of the mumps ending for the district on May 5th, unvaccinated students will be allowed to return to school on Monday.
So we're just basically following what the state health department has told us we need to do, and we're trying to make sure that we take care of the kids and the families we serve.
Sam Penrod, KSL 5 News.
Sam, thank you. Still ahead. Do you remember getting the MMR vaccine just once or twice? The CDC's three-step approach to make sure you're protected.
And state health officials are highly concerned about the spread of measles in states all around us. Their plan to keep Utah in the clear. As measles cases continue to spread across the United States, public health officials here in Utah are hoping people will make sure that they are up to date on their vaccinations.
And they're warning, even if you did get the shots, you may not be fully protected.
Workers at the South Main Public Health Center say there has been a spike in interest in the mumps, measles, and rubella vaccine. One nurse says typically they do not get any calls about it. Well, over the last week, they have had people coming in asking for the vaccine every single day. News special Sean Moody now explains.
Are you doing lots of these right now?
Matthew and Juliana Aaron made time in their schedule today for a quick visit to the health department.
It's pretty scary, I think. I don't want my children sick.
News about the spread of measles had them concerned, especially when they realized their childhood vaccinations may not fully protect them. People born before 1989 likely only had one dose of the vaccination, which may be less effective than the current recommendation of 2 doses. There are no known measles cases in Utah yet, but public health officials believe it's a matter of time.
We probably won't escape because people travel so much in the United States.
Dr. Alan Nakashima is an epidemiologist for the state. They're concerned because they know a number of people are not vaccinated. Mumps are prevented by the same vaccine. In a typical year, they see 2 or 3 mumps cases. This year, they've seen 13.
When we see an outbreak of mumps, we know that we have pockets of people within Utah that are unimmunized and so susceptible.
She knows a lot of people choose not to vaccinate, sometimes based on misinformation spread through social media.
If you want the correct information, then I think probably people ought to be looking at the Centers for Disease Control website, things like that, where they can get real scientific information.
That's all? That's all. All right, that's easy.
The Aaron said getting this done today was their civic duty.
And people's lives are in the balance here. There are a number of citizens who can't. They absolutely cannot be immunized as a result of, autoimmune or issues with their own immune systems. And so, that's where we protect them.
Sean Moody, KSL 5 News.
Sean, thank you. The MMR vaccine is available at most clinics and local health departments. Health officials say you should call ahead to see if it is available, even though they say there are no supply issues.
Coming up, steps you can take to ensure you are protected from the measles.
With news of mumps and measles popping up across the country, many adults are wondering whether they were vaccinated as children. The CDC has a list of ways to find out. The first place to start, if possible, is your parents and see if they kept any vaccination records. Sometimes employers like the military require immunizations, and they may keep records. And if you can't locate your records, doctors can do blood tests to see if you are immune to certain diseases. You can find all of our coverage on the measles outbreak and how to protect yourself on our free KSL TV app. Just search measles.
Okay, thanks for joining us, everyone. That is our report for tonight. Have a great weekend. We'll see you back here on Monday. That's all I got.
That's all I got.
It's going to be a great weekend. Good night.
See ya.